nursing student here at Northwestern State University, and I'm going to be part of your medical team today. I'm just going to do a full body assessment on you. Is that okay?
Yes, ma'am.
All right, now I'm just going to shut the door to provide you some privacy, and I'm washing my hands to prevent infection, and I just need to verify your name and your date of birth.
Ashley Painter, 10/19/92.
All right, great. Your vital signs have been attained, and I'm going to put this bed up to waist height to make it a little bit more comfortable for me. And I'm just going to put down this arm rail so I can get to you a little bit easier. All right, now do you know where you're at?
I'm at the hospital.
At the hospital? All right, do you know what day it is?
It's Wednesday.
Do you know why you're here?
I've been having a sore throat.
Sore throat? Okay. Are you having any trouble eating?
Yeah, a little bit.
All right. How's your appetite?
It's not been very good.
All right, so you're having trouble swallowing?
Yes, ma'am.
All right, where does it hurt exactly?
It hurts right here.
All right, when did that start?
About 3 days ago.
3 days ago? Do you feel like anything bothers it?
When I eat and drink.
Okay, are you taking any medicine for
I've been
it?
taking some of that antiseptic
All
to
right.
numb it.
Okay, what does it feel like? Like a sharp pain? Or?
Yeah, it's like sharp and it just keeps going down.
Okay, how long does that last?
About 20-30 minutes.
Okay, well the doctor has ordered you some pain medication. Once I'm done with your assessment, I'm gonna bring it back to you. So,
Okay.
all right, so I'm just gonna start with your cranial nerves. I'm gonna sit you up. All right, so the patient is alert, awake, and oriented ×4 to person, place, and time. Now, how many fingers am I holding up?
2.
All right, now just watch my finger. I'm looking for the eyes to converge and the pupils to dilate. Now, just keep your head straight and just move with your eyes and just watch my pen light. Okay, great. Now just look straight. I'm gonna look for your pupils to dilate. I'm just gonna shine this light in your eyes. All right, the pupils are equal, round, and reactive to light and accommodation, Perla. Now I'm just gonna leave this out and I just need you to open up your mouth for me and say ah.
Ah.
All right, I don't see any lesions or indentations. Your uvula goes up symmetrically. Your mucous membrane is pink and moist, and I'm just gonna put on some gloves. All right, now open up your mouth. All right, your gag reflex is intact. Can you put out your tongue for me? All right, I don't see any lesions on your tongue. Can you move it side to side? You have full motion of your tongue, and your lips are pink and moist. And can you push your head up against my hand? All right, push up your shoulders. Great. Can you raise your eyebrows? Puff out your cheeks. Smile. Grit your teeth. Okay, great. And can you close your eyes for me? What do you smell?
Alcohol.
All right. So now I will auscultate your lungs. I'm going to go to the second intercostal space, to the aortic. Now just deep breathe in through your nose, out through your... I'm listening for your heart, so you don't have to breathe or anything. I'm just going to go to the second intercostal space, to the aortic. I'm going to go to the center, to the second intercostal space, to the pulmonic. The third intercostal space, the Erb's point. The fourth intercostal space, tricuspid. And then the fifth intercostal space, down to the center of the mid-clavicular line, the mitral valve. All right, your beats are about 60 per minute, and then your S1 and S2 are heard distinctly. Now I just need you to sit up for me. Okay, now I will auscultate your lungs, and I will just deep breathe for me. In through your nose, out through your mouth. All right, now just give yourself a big hug and put your chin to your chest. Listening to the sides. All right, your respirations are about 16 a minute. Your chest rises and falls symmetrically, and your breaths are even and unlabored. Now I'm just gonna sit you back. I'm gonna lay you down, and I will check your arms. For temperature, your skin is warm. I don't see any lesions or any bruising. The color of your skin is to your ethnicity. I will pinch and poke for skin turgor and edema. I don't see any edema in either arms. I will pinch right here. I don't see any. And then I'm gonna check your capillary refills, about 2 to 3 seconds on this hand, about 2 to 3 seconds on this hand. I'm gonna check your radial pulse. All right, your radial pulse, the rhythm is strong. It's about 65 beats a minute, and it's 2 plus equal bilateral. Now, can you squeeze my fingers? All right, great. Your strength is equal on both sides. Now I will check your abdomen. I'm assessing for any hernias or deviations. Can you put your chin to your chest? All right, I don't see any hernias. I don't see any bruising. The umbilical cord, the umbilical is dry, and I will now auscultate the right lower quadrant. I'm listening for any bowel movements. All right, now the left upper quadrant and the left lower quadrant. All right, it's about 5 to 35 a minute. Now I will percuss. I'm listening for that tympani, right upper, left upper, left lower. All right, and have you had any bowel movements today?
Yes, ma'am.
All right. Do you need to go to the bathroom or anything?
I already did.
You already did? Okay, now I'm going to palpate your abdomen. The right lower, right upper, left upper, and left lower. All right, I don't feel any hernias or anything irregular. Now I'm going to move down to your legs. The temperature is warm, getting cooler to the feet. The skin is dry. I don't see any edema in the right leg, no edema in the left leg. And I'm going to check your pedial pulse. All right, this is equal to plus bilateral, about 60 beats a minute. And can you dorsal flex for me and plantar flex? All right, the strength is equal on both sides. Can you push up on your arm for me? All right, push up on your arm. Can you push up, push up? All right, the strength is equal in your arms and equal in your legs. And now I will set you up. I will turn you on your back side so I can check the back. Just cross your arms. All right, I don't see any skin breakdown or lesions on the back of the head. I don't see any on the scapula. I don't see any skin breakdown on the coccyx and no skin breakdown or lesions on the back of the heels. All right, great. Now I'm going to set you up to a comfortable position.
That's good.
That's fine. All
Yes,
right.
ma'am.
Now I'm checking if you had any IVs or any tubes. If you had anything, I'll check to make sure it's set correctly, make sure it's in correctly, if you had a catheter or anything. And here's the call bell if you need anything. And do you need to go to the bathroom?
No, ma'am, I'm okay.
All right, you're in a comfortable position.
Yes, ma'am.
All right, well, if you need anything, just hit that call bell and I'll be right back with your medicine.
All right, thank you.
All right, thank you.